I've also heard from a number of school superintendents all across my state opposing the Medicaid cuts because of the harm it would have on the thousands of students across the Hoosier State. Schools use Medicaid funding for certain health-related services they provide, including individualized education plans, special transportation for children with disabilities, social workers, physical and occupational therapists, and medical equipment at the schools. Some school districts use Medicaid to help pay for a health professional or a full-time registered nurse at schools across the country where they assist with students' complex medical needs and treat students with everything from illnesses to asthma attacks. As school districts and local governments across the country continue to make even more difficult budget choices, cutting off this critically important source of funding creates just one more huge challenge. In addition to trying to make up the lost funding, our communities and states could be impacted in other areas as well. Infrastructure, other education spending, police and fire, and other local priorities. The plan from my friends across the aisle undermines coverage for millions, but we haven't even had a hearing on their proposal. Committees haven't been able to go through regular order to examine the merits of Medicaid and the Medicaid expansion and how gutting them would harm millions of people. Children with really complex medical conditions, those struggling with substance abuse disorders, and seniors in nursing homes. All they're asking is trying to live with dignity and peace. My motion sends this bill back to the Finance Committee to ensure we are protecting those Americans who are the most vulnerable among our society. It would allow us to move toward strengthening health care for our country. If you believe we should support children and families with complex medical conditions, then you should support this motion. If you want to protect the 1.4 million seniors using Medicaid for nursing home care, then you should vote for this motion. And if you want to continue the progress we've made fighting the opioid abuse and heroin use epidemics, then I ask for your vote in this effort. I firmly believe we can improve health care and build upon the gains we have made if we work together. Together. Not as Democrats or as Republicans, but as U.S. senators and Americans in a bipartisan manner. This is not a political game. The consequences are as serious as it gets, and the American people are counting on us. I urge my colleagues to support this motion. Thank you, Mr. President.